Erection is a sign of masculinity and fertility. But what if your erect penis refuses to fall? This is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria.
My name is Dr. Okafor Chidumeje,
the
Lupus
OurDrKing
Day Foundation Nigeria, convener, Triathlon, the Lupus Day. I was just about eating my lunch when I got a call that there is an emergency waiting for me, so I had to leave this lunch. I am now coming back. This is like 3 hours later, so whatever I see now, this drink was initially chilled, but it's now hot, and this food will need to be microwaved before I can eat it again. So what was the emergency I met? Okay, so it was a young guy, about 23 years old, who came with penile erection. His penis has been erect, according to him, all through the night. So he's been trying everything possible to bring it down. I think he started around 4 a.m. and calculating from the time, that means from 4 a.m. this should be around 2:30. I think I was called down. I was about eating my lunch around 2:30. So from 4 a.m. to 2:30, that was when I went to see him. So I now had to ask how long. Of course, how long has it lasted? He told me. The next question I asked was, has this kind of thing ever happened before? He told me yes, that something like this has happened before, but it just took it didn't last this long. It lasted less than almost 2 hours or 2 hours plus, but less than 4 hours. Then of course he told me what he did that really did, the mode of treatment. The next thing I asked was, does he erect well? That if he wants to perform with his woman, does he erect well? He told me yes. So that means he doesn't take any erection drugs. So the next question was, I asked him, do you take any other drugs? Like, are you on any prescription medication? Of course, what I had in mind was things like antidepressants, like chlorpromazine, trazodone, risperidone, phenoxybenzamine, all this kind of drugs. So, but he told me he's not on any of them. So the next time I asked him is whether he has any hemoglobinopathies, like sickle cell anemia. He said yes, he has sickle cell anemia. Then I also asked him whether he had any trauma there, maybe he had any injury, any fall, any blunt trauma or any kind of injury around there. He said no. So now I'll tell you why I was asking all these questions. It's important to get to know that. Okay, so I moved in straight and started with giving him, of course, set an IV line, started with hydrating him, sent his blood for tests. So, and then gave him oxygen, and then went straight to the area. After some cold compresses, I had to do what we call aspiration. I had to aspirate from the lateral edges into the corpora cavernosa, to just aspirate with large bore cannula 18G, and the small syringe like 10 mils. I used to aspirate almost about 15 mils of blood. Then after that, I had to inject diluted phenylephrine into those spaces. Okay, so now gave him some other medication, pain relievers, and of course sent him home for him to now come back on Wednesday and see the urologist. So now the next thing is, what is the diagnosis of this man? So this man is suffering from what we call Priapism, Priapism, Priapism. So what's Priapism? Priapism is an involuntary, unwanted, prolonged penile erection that is not related to sexual arousal. And we have there are so many causes, and the causes can be from abuse of not only yes, abuse of drugs like alcohol, cocaine, and it can also come from drugs like prescription drugs, normal drugs that you are prescribed, like antidepressants like promazine, Lagatil, and risperidone, trazodone. It can also result from hemoglobinopathy, just as I've listed, like sickle cell anemia, sickle cell disease, and then finally can also result from trauma to the penis. Okay, so now there are two common types. The stuttering, that's the one, the stuttering type, that's the one you see mostly in sickle cell disease, and then the acute or prolonged type. The stuttering type mostly lasts within 30 minutes to less than 2 hours. Then the prolonged type lasts more than 4 hours. The classification, Priapism can be classified into the ischemic type and non-ischemic type. The ischemic type is the low flow type, extremely painful. It is the type that this man was suffering for. The non-ischemic type is the high flow type, painless, and can be left for almost up to some months or weeks to resolve on its own. While the low flow type, that is the ischemic type, is a urologic emergency. Okay, so the major problem in the low flow type is actually that the venous outflow, the vein that should take blood away from the penis, is blocked for whatever reason. While in the high flow type, the problem is that the artery that brings blood inside is overworking. That is, it just keeps bringing blood, doesn't want to ever stop. So it becomes persistent. That is why it's not so turgid, because the venous flow in high flow type, the penis is not so erect, so turgid like the other one, because there are still chances of blood going out. In fact, in the high flow type, the blood is mostly it's mostly caused from pseudoaneurysm or atrial spongiosum fistula. While in this other type, in this low flow type, it's mostly, that's why you see sickle cell anemia. That's why you see most of those ones caused by drugs, like these drugs used for erectile dysfunctions, like prostadil, sildenafil. That's why you see those ones. It's always very, very painful. So it's a urologic emergency. So that means immediately this kind of patient comes, you should, if it's a normal patient, maybe not sickle cell, go straight to the point, give pain relief, go to the penis, do your little aspiration, make sure you target the 2 o'clock and 10 o'clock sites, so that you avoid the dorsal vasculature.
Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, Traitathon, the Lupus Day.